So my name's Lisa Carson. I'm Deputy Principal Perfusionist at the University Hospitals of Leicester. So what does a perfusionist do? So generally we take on the role or do the role of the heart and lung while the surgeon fixes any issues with the heart and lungs. So that's the main part of our job. But the other part of our job is we do something called ECMO. So ECMO is extracorporeal membrane oxygenation. If we need to move a patient to either a specialist centre or the patient is incredibly sick and normal conventional ventilation methods aren't working, we can move them to Glenfield or to other centres that have specialist treatment to hopefully make them better. In these sort of roles, experience is a wonderful thing. You live and learn. And obviously to speed up that learning process, simulation allows us to practice things, practice what we do without any risk to a patient. It also allows us to practice when things don't quite go to plan. So if you liken it to like a Formula One team, they rehearse and practice changing a tyre. And we can do the same sort of things with emergency scenarios. So if something does go wrong, we can react really quickly because obviously we want to minimise the impact to our patients. So ECMO doesn't happen very often, so we don't get exposed to that much. Like I said, it's commonly thought of as a last resort when other methods haven't worked. So to make sure we are proficient and we're good at what we do, we simulate. So having aids that can help us make it more realistic and more interactive allows us to be proficient in spotting problems and dealing with issues and basically make it more realistic and real life so we can respond appropriately as a team. So in doing that, we're practicing our skills and hopefully with improving the skills we will deliver better patient care. So on the whole, from a perfusion point of view, it's very similar. The major difference is obviously the babies are a lot smaller and you tend to find changes happen that little bit quicker. But the premise of what we do and how we do it, building and priming circuits which will support the patient, is the same. Troubleshooting those circuits, it's the same, slightly different parameters. So the main thing is just understanding the difference, but in long and short of it, it's pretty similar, to be honest. So, you know, things do go wrong because we deal with very sick patients. So something we like to practice and rehearse is the exchange of the membrane lung or the oxygenator, so essentially the lung. So when the lungs are failing, ECMO does the job of the lung. Now this can fail because of the patient's disease and sometimes we don't know when it's going to fail. But when it does happen, you have to respond really quickly because you need oxygen to survive. So as I mentioned earlier, you liken it to a Formula One changing a tyre. We need to change that oxygenator very quickly. So practice using simulation and what happens in those scenarios, make sure we're able to change that oxygenator, resume support for the patient in a very quick manner. And the more you do it, the better you get at it. So that's the beauty of simulation. And then you have the added input where you get patient additional tidbits to the scenarios, which make it even more real life. So what's really nice is the interactivity. So we have a set scenario that we're trying to run through with participants, and if they alter a drug or alter a certain treatment pathway, we can get our simulator to respond in a true lifetime fashion. So we're getting the normal sequence of events, and the simulators and the devices work really well, that we can change things without people knowing. So it's like a real life situation. You don't know that something's going to happen, so we're checking that people are watching what they're doing and that they're responding appropriately. And because of the interactive of the technology, it works really well and makes it easy for us as simulators to be able to do that. So it's really nice the fact that you have a printer to do blood gases. You have you can scan the heart and the lungs using ultrasound. So it's super realistic without having to use hospital resources. And the fact that you can then actually cannulate, so put the pipes in the patient, connect the ECMO circuit up, you can learn how to do that. And then on top of that, you can make the simulator behave in like a real life patient. So things that happen when the blood pressure goes up, you get real life responses. So for the completeness of the package, it makes it basically as true to life form as we can get at this moment in time. You know, we're not hit perfect yet, I'm sure, and I'm sure you'll continue to develop and sharpen those skills, but we're definitely on the right pathway, and it's really fun as a simulator to be able to use those devices to help train. So I'm a perfusionist, so I like to see going on to ECMO and seeing the heart behave and respond to volume and things that will affect the circuit. Because trying to mimic that without a simulator is really very difficult. So it allows us to, like I said, mimic hypovolemia when you don't have enough fluid in the body, or the stopping of a vasoconstrictive drug so the blood pressure isn't high, and the response that your pump and the patient has is realistic. So yeah, so basically it makes us better skilled, more proficient, and we get to train not in a real life scenario, so in a nice controlled environment with slightly less stress than the fact that you're doing things on a real patient, and it makes you feel that actually when you actually come to do the real thing, you feel confident and skills, and you've had enough, if you like, practice of doing what you do. So improve your skills ultimately. I think they're really interactive. We've used faculty that are renowned for their ECMO skills, and we've tried to apply it. Essentially, we've tried to make it as real life as we can without, normally doing simulation for flights is an extremely difficult thing to do because there's lots of restrictions at air bases and things like that. But we've tried to do that here and integrate a bit of fun, because learning that is fun, you remember. The same, we've had the ambulance here. So again, the delegates have had exposure to actually sit in an ambulance and practicing how to get a patient in and out of an ambulance. It sounds really simple, but in reality it's very tricky when attached to an ECMO circuit and all the things that you need to be aware of. And then we've managed to do a scenario actually driving an ambulance. So basically the delegates have really experienced the full shebang as much as we can without the real life thing today. That's incredibly proud. Glenfield and UHL have a long-standing association with ECMO, and to continue to be seen at the forefront of kind of ECMO training and provision, it's a real privilege. So yeah, I mean, it's a great opportunity for people that don't get much exposure to have, world-class faculty and learn tips, tricks, things that have gone wrong, and all that sort of thing. So from a learning point of view, there's a phenomenal amount of resource. And with the simulator company's products, we're able to bring that to life, which makes it memorable and makes that learning even deeper. So I'd absolutely recommend using the simulator products again.